There's two main types of injectables. There are the neuromuscular blockers like Botox, and then there are the fillers like Juvederm, Restylane, Radiesse, and Sculptra, and they have a little bit of a difference. Botox works on wrinkles in motion, so what that means is wrinkles formed by repetitive facial expressions over time are caused by the underlying musculature. And Botox prevents the nerve from sending the signal to the muscle to make that particular facial expression, thus smoothing out that wrinkle. Wrinkles like on the forehead, the horizontal lines when we raise our eyebrows, or the vertical lines in between in our eyebrows when we scowl, or the crow's feet. That's where Botox is used. Whereas fillers are used to replace volume. Over time, we all get a little bit of volume loss in our face. We lose fat and collagen and even bone. And fillers are used to inject directly underneath the surface of the skin to replace that volume. There's several different types of fillers. There's a broad category called hyaluronic acid fillers. Hyaluronic acid is a complex sugar that's normally found in the skin. It binds water and kind of acts like a sponge, replacing volume underneath the surface of the skin. Hyaluronic acid fillers are very popular. They're instant when we inject them. Juvederm and Restylane are two of the biggest hyaluronic acid fillers. I use these fillers in the tear troughs, which are the hollows underneath the eyes that we get over time, as well as in the lips and around the mouth. Radiesse is a little bit different. That is a calcium hydroxyl apatite filler. That is a normal component found in our bone. And this particular filler is injected underneath the surface of the skin, and it acts as a scaffold for collagen to be stimulated and grow. So it can last a little bit longer, a year or more. And that one's a great filler to use in the cheeks, back to the hands, along the jawline. So all of these injectables have a certain amount of longevity. They wear off somewhere in the neighborhood of 3 months with Botox to several years with some of the more longer acting injectable fillers. And they do require a bit of maintenance because they do wear off. They can be stopped at any time though, so if there's a particular patient who doesn't want to continue the maintenance, they can stop getting their injectables without any side effects. There's no downtime for these injectables. You may get a little bit of bruising or swelling that usually goes away within a couple days. Most patients go right back to work. With any procedure, I think it's important to have a consultation to really target your particular concerns and discuss the risks and the benefits and expected outcomes. Patients really do get a lot of bang for their buck with these procedures. They really get to the root of their concerns and get very natural and satisfactory results.